Many dogs and cats have intestinal upset, such as vomiting, diarrhea, or even soft stool. This may occur daily or possibly just once or twice a week. If you notice any of these clinical signs in your pet, they may have a condition called inflammatory bowel disease, commonly referred to as IBD. To learn more, we'll meet with Dr. Julie Stegman, who's board certified in veterinary internal medicine.
Inflammatory bowel disease, otherwise known as IBD, is a condition we see in both dogs and cats, and it's most similar to Crohn's disease or ulcerative colitis in people. It's a dysregulation of the immune system at the level of the GI tract, where the GI tract has lost tolerance to normal bacteria and normal dietary ingredients. That causes inflammation in the lining of the GI tract, and that will then lead to the clinical signs. There are certain breed predispositions. The most commonly would be Yorkshire Terriers as well as German Shepherds. However, inflammatory bowel disease can affect any breed of dog as well as it affects many breeds of cats, including domestic Shorthairs. Clinical signs can vary from simply just weight loss without a good explanation, to poor appetite, to vomiting or diarrhea, or a combination of all of the above. The criteria for diagnosing inflammatory bowel disease are first, chronicity, which means more than a few weeks in duration of clinical signs. Second, failure to respond to those diet trials and medication trials mentioned. And third, it does require a biopsy, obtained by surgery or by endoscopy, that indicates enough inflammation to explain the clinical signs at the level of the GI tract. Over time, the goal is to try to reduce the medications to the minimum effective dose or possibly discontinue them altogether. But this is typically done over a course of a few weeks to a few months. So that's under the guidance of the veterinarian. Ultimately, I always tell clients that inflammatory bowel disease, because it's an immune-mediated condition, is not curable, but it's controllable. And most of the time, these patients have a great quality of life. An important part of managing a patient with IBD is to address the diet. And as far as the diet change goes, you have to think of it sort of like an acquired food allergy. Typically, the response is going to be most severe against the protein portion, but occasionally it's against the carbohydrate portion of the diet. So if we have a patient, for example, that's eating a chicken and corn-based diet, then we will change that diet to, say, venison and potato, something entirely novel that the pet has not seen before and therefore should not be reactive against. And in consideration of that diet, once the pet is on that diet, we need to try not to introduce other foods into that diet by adding treats that are outside of those ingredients, or even using certain foods to give pills. That peanut butter that you used to give is out. We need to have a very strict limitation of the ingredients that go into this pet's mouth. That also includes flavored medications and really anything that goes into the pet's mouth, sometimes also even chew toys. You need to kind of remove things like basted chew toys from the environment until we have a better control over the condition. The first thing that we may do is to give antibiotics to reduce the overall bacterial count and sometimes shift that bacterial population a little bit more toward what might be normal. If that is not enough, sometimes we'll also give probiotics, which are beneficial bacteria, and you need to pay attention that these are not just probiotics that are over the counter for people, because dogs and cats have different needs than people and from each other. So they should be probiotics that you obtain from your veterinarian. One other thing that can be given is a prebiotic. And prebiotics are small soluble fibers that are assimilated by the body and cause fermentation within the colon to cause the good bacteria to grow back to their normal levels. Any combination of these three could be used in the individual patient, and it takes some trial and error sometimes to find out which it is that's going to work for that pet. In addition to the usual therapies for inflammatory bowel disease, it may be necessary for certain patients to receive other medications to help control the clinical signs. And this can include anti-nausea medications, specific anti-diarrheal medications, and antacids as well. Within each category, there's several different types as well, and so this also may take some trial and error to find what works best for that pet. Your veterinarian is really going to be your best resource for adjusting any of these medications.
Inflammatory bowel disease may be controlled with diet and various medications. If your veterinarian chooses a dietary plan, it must be very strict. This means absolutely no treats, chewies, or table scraps. I recommend you ask your veterinarian for the best plan specifically for your pet.